So are you wondering when to increase the amount of feeds for your baby, especially when you're bottle feeding? Well, that's what we're going to talk about on today's video. This is Dr. Obidi, pediatrician at Partners in Pediatrics and Family Health and CEO of Newborn Prep Academy. And I get this question quite often, wondering when it's that time to increase a baby's feeds quantity-wise when they are bottle fed. Now, if you're breastfeeding, this is one of the beautiful advantages of breastfeeding because your baby just generally will take what they need, and so you don't have to worry about quantity. And I know it can be quite anxiety-provoking for a number of moms earlier on because you're not exactly sure how much your baby is consuming. But usually those babies are fall very closely in the first few weeks of life, and you can tell after a while that your baby is growing, they're adding weight, and they're really satisfied after every feed. And I think most moms will eventually sort of, come to be very comfortable knowing that their babies are getting enough. But if you're formula feeding or you're feeding express breast milk and so you're feeding out of a bottle, you may be wondering, at what point do I increase the amount of formula or breast milk that my baby is getting through the bottle? So most newborns are probably going to take anywhere from 30 to 45 ounce milliliters, that's about half an ounce or a quarter of an ounce initially. It does quickly sort of ramp up to 1 to 2 ounces. So that will be 30 to 60 mLs per feeding. And typically your baby will feed anywhere from 2 to 3 hours, every 2 to 3 hours, maybe even more frequently if they're cluster feeding. But at some point, you get into this nice routine feeding your baby. Maybe they're taking 2 ounces, every 2 to 3 hours. And at some point you're wondering, okay, is this enough for my baby? When do I increase the amount? Because I know they're not going to take 2 ounces forever, right? We know they're going to take more as they grow. Well, I have found that this is something that you really are going to have to just learn your baby's cues, their hunger cues, their satisfaction cues to see when they've actually had enough. Most babies, when they're full, will start to pull away from a bottle or will sort of, begin to suck very weakly. They're not actually taking strong sucks anymore. And so milk starts to pour out their mouth because they're not swallowing as much milk. Usually that's the point where you want to stop bottle feeding your baby because if I've had enough typically. And you may burp them and see if they're still interested, but typically most newborns, when they've taken, whatever that quantity is, 1 or 2 ounces, will look satisfied. Now, the way to know that you probably need to prepare more milk for your baby is when they've finished the 1 or 2 ounces or whatever you're feeding them, and they're still hungry. They're still actively sucking on that bottle when it's empty or looking like they're really not satisfied. They're still kind of rooting and looking for the bottle when you finished what is in the bottle. That's a point where you can sort of start to decide that your baby probably needs more and you can prepare more. So maybe you prepare 3 ounces and maybe they take 2.5 instead of 2 ounces. Or maybe they take all 3 ounces and they're still sort of hungry. So I think there is some degree of trying to figure out with your baby what they need and paying very close attention to their hunger cues to know when to feed them and their satisfaction cues to know when they are satisfied. Well, I hope this is helpful. I know lots of new moms and dads are sort of uncomfortable about that topic and not quite sure. But I believe this is one of those things where, as you get more comfortable with your baby, you kind of get more at ease and know that you're providing proper nutrition for them in the right quantities. And of course, hopefully you're also visiting your pediatrician or provider regularly and they're weighing your baby, asking about how they're doing and, following the developmental milestones. And so hopefully allaying your fears that they are doing really well. So there you have it. Those are the ways to know this is how you know when to increase the amount of formula or breast milk that your baby is feeding through a bottle. And hopefully you found that helpful. If you're new to the channel, go ahead and subscribe so that and hit that notification bell so you know when we release a new video, and share this with a friend who is expecting a newborn or is caring for one right now, because we have lots of content on the channel that will help them care for their newborn confidently. Again, this is Dr. Bidi, pediatrician at Partners in Pediatrics and Family Health. If you're in the Washington County area, we would love to care for your newborn. Just call the office at 301-791-7060. All right, bye for now.